Please let's not encourage people to put yogurt on their skin.
It is an offence to display it if you are not.
Why did we bother doing decades and decades when we could have just...
I'm not saying I disagree with you. I'm just saying I don't love it as much as you.
Hello and welcome to the After Hours Skin Clinic.
The laid-back, information-packed podcast with expert skincare advice that you can trust.
And the place where the skincare conversation never stops.
I'm consultant dermatologist Dr. Emma Craythorne.
And I'm consultant dermatologist Dr. Ellie Rashid.
And we're officially into the first month of 2026. And so it seems like a good time to talk about what's trending and what's going to be here to stay this year.
And what should probably stay in 2025.
We're going to break down the big attitude shifts and have a look at the ingredients and AI that everybody's talking about.
From barrier-first skincare and longevity routines to biotech beauty and AI skin analysis.
This episode is about genuinely trying to cut through the noise and find out what is going to work in 2026.
Okay, let's get into it.
So can I be slightly controversial here?
Oh my God, do please, always.
This is where we'll probably disagree.
Always.
Because I actually think one of the trends of 2026 might actually be that we're going to officially finish with trends.
I'm not surprised because the trend in 2026 is that we're going back to 2016.
Okay, tell me more.
So everyone is putting posts up about where they're at in their life in 2016. It's all about this resurgence of 2016. And so I think skincare trends will be like going back to basics, going back to the beginnings of all of this skin barrier hype and everything. I think it will be going back to those foundations of skincare.
I mean, I think that's right, because I suppose whenever you think about it in dermatology terms, it's not like every single quarter or every year there is a new thing that everybody has to do and everything else was, put to rest. Whenever we think about the foundations of how we look after our skin, it's actually grounded in decades of research. And the only reason that we know that something is effective and something works is because it's had all of those years beforehand where people have then spotted something, noticed that it's made an improvement, maybe in one or two people, and then thought, hey, let's get a few thousand people together and then let's run a study on this to see if this is actually going to work, rather than just I'm just going to try this and this works for me and my friends. So those things we know what works. And I think it's probably going to be, people are going to look for more honesty and more transparency and want to see where should they spend their time, where should they spend their money, and what's actually going to make a difference to their skin.
I'm so pleased you didn't use the A word.
What's the A word?
Authenticity. Just if I hear that word one more time.
So I thought whenever we were doing this podcast that you would have been coming in going, oh my gosh, Emma, there's this trend and we need to do this. And there's this trend and we need to do this.
When we knew what we were going to be talking about for the podcast, I genuinely spent 2 hours non-stop reading about all the new trends because I love this sort of thing.
Like, and how many were you like, I'm going to try that?
No, I'm not checking absolutely every single one of them. There's so many. There are so many. There are some that are like, right, strict. We know what works, exactly as you're saying. We know what works. Let's stick to that. Let's stick with the foundations. We've got decades of evidence to back that particular ingredient or that particular routine. So let's stick with that. But I think AI is going to have a massive influence in skincare routines.
The thing is, giving someone a good skincare routine relies on that person having been diagnosed correctly and relies on their skin being understood correctly. And obviously you can't make a diagnosis on AI. That's not something that's truly possible yet, because that would require certain tech approval that we don't have yet. So you're not going to have the diagnosis made. So I do think that there is a role for the algorithms that come into play, but true AI, I think that's not 2026.
I guess it's a good starting point.
I think it's a good starting point, but any of the AI tools outside those of which we're starting to use within clinical dermatology for skin lesions, but outside of that, where I see it very much within the cosmetic industry or within the makeup industry, where they'll say, put in your photograph, put in your skin, and then we're going to make you your absolutely perfect
I literally love
foundation.
Those. Yes.
I mean, I think they're fun. I don't really think the sensitivity and the specificity of them is going to be that accurate.
Oh my God, I love them. Do you not do the colour match for your lipstick? So I don't, but it's hard to online shop. You don't know what colour you're meant
It's
to be
very hard to
getting.
online shop, but even if you put in a photograph, the pixels and the colours of the photographs depends on which light you've taken it in, which monitor you've used, which camera you've used to take it. I
And the
mean, it's a bit
sunglasses,
more
do you ever do
accurate.
the sunglasses? I mean, there's so many good options.
I think I'm talking to my teenager here.
I think you need to have more fun with it.
I think I probably do. No, I do think that there will be this rule in the future, but I think they're gimmicks in 2026.
Bit of fun.
A bit of fun. Okay,
A bit of fun.
I'll let you have the fun.
But I think it will be a thing. Because at the moment, if we give the example of a teenager will walk into a store and does not have the first clue of what to pick out. Not have the first clue. And so I guess maybe as a good starting point, then something where a skincare routine is suggested based on their skincare concerns might be a good place to begin.
Yeah, true. But say, for example, said teenager has red spots and they think their red spots are acne. And they put the photograph in and the photograph just notices the red spots and says you have acne.
And it's rosacea.
And it's rosacea. You've just gone in and, you know, I just don't think that diagnostic part is good enough yet.
Yeah, we've not lost our jobs yet.
No, I think we've got a while to go.
Keep getting it wrong, AI. Well done. On the AI thing, there's this other thing that a brand's brought out. It's like a little sticker thing. It essentially is not as high tech as like doing proteomics. So proteomics are essentially when you normally would take like a sample of skin or a sample of blood or like a sample from a human, and then you run it in this analyzer. And essentially what it tells you is the expressions of different proteins within that sample. And so with that, you can look at like collagen expression or, you know, elastin expression, different types of proteins that are relevant in skin function longevity. You can think about how they are in the skin. Longevity clinics do it on blood samples to look at different proteins that are relevant for good cellular health, basically. And so we're doing two things in 2026. I think it's one, looking at AI and how it can help us in the dermatology sphere, whether that's to aid, you know, follow up or monitoring patients or, you know, taking care of them in a better way, or coming up with like first line skincare routines, not diagnosis, because I think you're right. We're far off a clinical diagnosis for the over 4,000 inflammatory skin conditions we have in dermatology. But then there are some systems now where we're feeding more and more data. And I think with time, to your point earlier, with time, I think we'll have both components. So more of these data points to be able to teach AI on what this all means for people's skin health.
Yeah, I mean, I think that's right. And even then, as you say, this idea of people wanting to see a measurable difference in their skin. So even the Clearer Day script last year, do you remember? So Clearer Day script is an all-in-one formula that you apply first thing in the morning. It's got all of your SPFs, antioxidants, nice peptides. But the idea behind it is really that it's a topical cream that reduces damage to the mitochondria of the skin. So in other words, helps your skin live better for longer in a way. But in order to kind of prove that, you don't really want to wait 3 or 4 years to see if wearing an SPF every day makes a difference to how your skin looks. You want to know whether that sunscreen is making a difference, you know, in a bit of a shorter time frame than that. So we did exactly that using a biomarker, with that biomarker being the mitochondrial DNA. And then you can understand whether your skincare is being effective or not. And I think you're right. I think that is probably going to be something that we're going to see more and more of, where people want to know, if I'm doing this, am I wasting my time?
And money.
Yeah,
totally.
or should I be doing something else instead? So I think the more skincare companies and dermatology companies can explain to people the true benefit, not the benefits that we see in marketing claims, which I think everybody is starting to try and see through now, but true, well done studies like we would conduct in medicine to say this is going to make a difference. I think people just want to see more and more of that.
Yeah, people's expectation is higher, isn't it? They want their ingredients for companies to prove that those ingredients will work, and that combination of ingredients in that particular formulation is going to work.
Yeah.
On that, particularly Clear as the example, I think that's another big trend. So combining lots of different ingredients that all have proven benefit for our skin health in one night cream and one day cream. So I think that is another big trend
Yeah, because people, I think, are starting to step away from this idea of 7, 10, 12 beauty steps. And even we now know as well, it doesn't really matter whether you put your moisturizer on first and then you put your, it doesn't really matter, these things, because the ingredients are getting in. So if you are able to have a formulation that comfortably combines all of these ingredients, then brilliant. Obviously, that's not possible because some ingredients perform better if they're in an acidic base and some perform better if they're in an alkaline base. But understanding what those ingredients are and how they can complement each other. And in fact, even this idea, like SkinCeuticals did with their CE ferulic, you have your vitamin C and you're adding in your vitamin E, and one almost helps to preserve the other. So your antioxidant benefit is more so.
Well, I love that whole concept of just using tretinoin and azelaic acid as like your prescription ingredients. And it just helps with so many different skin concerns. I mean, I'm not saying absolutely everyone needs to be on tretinoin and azelaic acid, but...
Did you see whenever we're thinking about this idea of transparency, where people might start to move away from those terms that don't really mean much, like the clinically proven, the natural, the
glass skin.
The glass skin, just moving away from that. Did you see the campaign The Ordinary ran where they did a periodic table? Have you seen that?
No.
It's a really great table. I don't actually agree with all of it, but I thought the campaign was brilliant. And they renamed it the Periodic Fable, which I just thought was absolutely genius.
Really clever.
So on this periodic fable, they have, for example, the letter K. So instead of being for potassium, it's then representing this K beauty inspired. Probably if it's K beauty inspired, a bit like most of these things, it's not actually from Korea. It's just kind of trying to emulate that. Or things like the M being medical grade, which, as we know, doesn't actually mean anything at all. But yet people think that the term medical grade means that it's the kind of thing that a doctor would use.
Well, they think it's a prescription.
Yeah.
They think it's a prescribed product. If someone says medical grade, if you're buying something that says medical grade over the counter, it's not medical grade. A prescription product needs a prescription. You can't just pick it up off the counter.
And I think you'll like this one as well. It's F, and the F was for flawless. I mean, when have you ever seen flawless?
Never seen flawless skin. If you've got flawless skin, you've got a serious issue.
To go through these terms that really don't mean anything, in the skincare world, I thought it was very clever to be as open as that. And I just wonder, is the trends going to start to move towards this of just real transparency?
Yeah, I think it will. I think people are looking for honesty and transparency, as you say.
But you know what then happens? A bit like all of these things, you then have people saying, we're being very transparent and this is what this is. And then you look at the science, and you're like, no, you're not being transparent. You're just being as bad.
I think a trend that is not a trend, it's literally been around for ages and it is here to absolutely stay, is our skin barrier and looking after our skin barrier.
It is here to stay.
It's definitely here to stay. It's been so buzzy for so long, but I think it's buzzy for good reason. And I think respecting our skin barrier and the focus on it and hydrating products and things that help with our skin's resilience and keep it well hydrated, all of that component of skin care aims are all going to be here to stay.
Yeah, because even now that we understand a little bit more about things like this term inflammaging that people kind of hear, that term simply just means that if your skin is inflamed, it will age faster. And, part of the most simple thing that we can do to stop our skin from being inflamed is actually just to put on a nice kind of barrier protecting cream. And that's even whenever you have very inflammatory skin conditions like eczema or psoriasis, right down to people who just have a bit of dry skin in the winter times. Just actually adding really good barrier protection will start to already reduce that inflammation and then the inflammaging.
Yeah, the only caveat I always say to my patients that have eczema or psoriasis is when you put a moisturiser onto inflamed skin, sometimes it can look a little bit more red as soon as you've applied it. And so I'm like, please don't worry, it will look a little bit more red just because you've made that very top layer of skin a bit more translucent, but ultimately it will help improve your skin.
Yeah, I think that's a really good point to say, because lots of people do put it on and then go, oh, this has made my skin really even more inflamed.
Yeah,
whenever
exactly.
It's meant to do that. It's just translucent.
Yeah.
it's a bit boring, but there are things that we know that are the best for the longevity and your skin health. I mean, it's really easy.
Yeah.
You kind of keep your skin barrier protected as much as possible, and that's usually by not using harsh topical ingredients or harsh soaps, using nice moisturizers where needed, protecting your skin from ultraviolet damage, which is
No-brainer.
the ultimate kind of ager of our skin. Also protecting it from where you can from oxidative stress, which is essentially where things, for example, like pollution in the environment, cigarette smoke, poor diet, and ultraviolet as well, cause free radical damage to the skin, and that ages the skin as well. Protecting from these things are the things that we know will make a difference. And then obviously protecting against inflammation, like we just said. But they're the key things. It hasn't really changed much. It's that protection. And then, of course, adding in of an evening, you want to say?
Tretinoin. Your vitamin A.
Yeah, so a prescription vitamin A, we know is the best thing that we have at the minute for improving the kind of quality and long-term skin health. But there are other vitamins
and
too.
also if you don't need a prescription tretinoin, then there are different formulations of vitamin A, like retinal probably would be the one to choose over the counter, followed by retinol.
And then things like niacinamide, nicotinamide.
Yeah, niacinamide. So this is vitamin B3. It's good for the skin barrier. It's actually got some good evidence for helping to hydrate the skin. And also it's used increasingly in products for pigmentation. Actually, we went to dinner the other night and it was for an antioxidant that's not a vitamin C antioxidant. So we always think about like the standard being a vitamin C in the form of L-ascorbic acid being a really great antioxidant.
Because it has the most studies.
The most evidence, absolutely. But it can be a real irritant and some people just cannot get on with it, which is fine. But now I think new antioxidants are coming through that are showing real benefits and they are doing studies on them. It won't have the same number or quality of studies that are already out there for vitamin C yet, but I think those will start to emerge through. So focus on antioxidants, but not necessarily just vitamin C. I think vitamin C is there and it's great for many, but some just won't get on with it.
I think that's right. And also vitamin C, in order to get the antioxidant ability that you get on the skin from the studies, has to be formulated in a way that for some people, the pH of it is just a bit too acidic. You know, it has to be right down at about 2.5. Our skin barrier pH is at around 5.5. So it is a bit of a shift. And for some people, whenever they get that shift, it's just too much in their skin. So it can be irritating. But, you know, at the minute, that is probably the antioxidant that has the most evidence behind it. But there are loads of antioxidants when we think about vitamin E is a wonderful antioxidant, green tea, coenzyme Q10, ubiquinone,
Green tea, I think, is going to
resveratrol.
make a big surge.
Yeah.
Big surge? A big surgence.
Big
Resurgence. The big sur. Green tea's been around forever.
Yeah.
There are so many studies going back decades when it comes to green tea and e.g. CG, one of the chemicals within green tea. It's definitely on the rise again. I'm seeing it loads.
Yeah, so I think those together, and then you can formulate it with other ingredients that don't require it to be quite so acidic. So you can package it all in together. Going back to your second point of trend, formulating it all in one.
The one that we differ in our opinion on is peptide.
I'm not saying I disagree with you. I'm just saying
I don't love it as much as you.
I don't love it as much as you. You have to agree. The evidence
I do
is
agree.
amazing for SPF, amazing for tretinoin and retinoids, good for antioxidants. I'm going to say amazing SPF, excellent for tretinoin, okay for vitamin A otherwise, okay for...
Better than
what was I saying?
Vitamin C.
More
than okay for vitamin C.
Okay to good.
I'd say good. Go for it.
Okay, good. Antioxidants, good. Peptides, no. No, actually, peptides, not enough. How about that?
What I would say is I would probably filter it slightly further. I'd say peptides, really good and robust evidence when it comes to test tube and what's called ex vivo. So this is on samples of like human samples, like skin samples that are grown in a lab. And then you can prove that something has a clinical benefit.
On a piece of tissue in a lab.
On a piece of tissue in a lab. In vivo, which is on human, in the person, clinical studies are lacking for peptides, but they're also lacking for many, 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 many other ingredients.
Yes.
It takes ethics applications, huge amounts of money and funding, huge amount of effort.
And why bother when you can just say,
And why
this
bother when
works?
you can just say it?
It works.
It's like us dermatologists. Why did we bother doing decades and decades when we could have just put it on our Instagram profile? Dermatologist.
Why Ellie is saying this is that the term dermatologist is not actually a protected term. And so anybody can call themselves a dermatologist. And I think perhaps Ellie might be slightly annoyed having gone through social media looking at people calling themselves dermatologists who are not dermatologists. Is this another word that's annoyed her today?
Oh, why did we bother?
Because you wanted to know everything there was in the world to know about the skin.
And I bloody love it.
And you love it. And I mean, you want to just dig deeper and deeper and wider and wider. You wanted to do a PhD in it.
I love
you
it.
want to do science communication. You
Lived
want to
and
work in a
breathed
teaching hospital.
dermatology. Lived and breathed it.
That's why you did it. But actually, maybe that's a new trend as well. Maybe people are going to look out for not just the transparency of ingredients and formulations, but maybe the transparency of qualifications in people. Maybe that's going to be a trend in 2026.
I hope so. I didn't see it in my hours of research, I must say.
But what about the logo that the BAD have produced now, the trademark?
I mentioned it to a patient the other day and they're like, I mean, that's not going to work. So essentially, to be a consultant dermatologist means that you've gone through your specialty training and you've passed all your exams, you've done all the clinics day in, day out, worked really hard, and you've come out the other side as a consultant dermatologist. And that means you can then use the term consultant dermatologist, but the term dermatologist can be used by anyone. So anyone and everyone. So the British Association of Dermatology, they thought to try and tackle this challenge that they would give a blue tick to those of us that have completed this rigorous training and are consultant dermatologists.
Which is a trademark.
Yes.
Which means that you can only display it if you are a consultant dermatologist. And if you're not a consultant dermatologist, you can't display it. But it's actually, because it's a trademark, it is an offence to display it if you are not. Whereas it's not an offence to say that you're a dermatologist, even though that potentially might be misleading for the public. That is not an offence. But the term dermatologist can't actually be trademarked. Whereas this logo, this is essentially a trademark. So it is a good thing to look out for. And I think they probably just maybe haven't done a good enough job in letting everybody know about it.
I feel like only consultant dermatologists know about it.
Yeah.
I don't feel like even my doctor friends would know about it necessarily.
Are there any ingredients that you can think of that might be trending? Obviously, we've just said the things that shouldn't trend because we know that they work and they should be there to stay.
So peptides I absolutely love. And as you're saying, there's not that much evidence for it in people, but emerging. But then I do want to talk about PDRN as an ingredient. So PDRN, it stands for polydeoxyribonucleotide, and it comes under the umbrella of polynucleotides. And PDRN has a really specific role in the skin. It activates this receptor, and that receptor, when it's activated, it can then signal for more collagen elastin to be made in the skin. And so PDRN can be injected. And now PDRN has been incorporated into topical skincare routines. So before, in order to have PDRN injected into the skin, you'd have to see a dermatologist or a healthcare professional that would then do that injection for you. And it's quite costly as well. Now, PDRN has been encapsulated and it's incorporated into topical skincare. So then you might think, yeah, but how on earth is that going to get to like the deeper layers of the skin in order for it to have any real benefit? They've tried to do that by putting it into this little like lipid encapsulation or combining it with other ingredients that means it can sink deeper down into the skin.
Surely it's too big.
I mean, there's a few brands that now have it. And I mean, they are doing...
That doesn't mean anything.
No.
When did I get so cynical?
But they have got some studies. But I mean, you know what it's like. If it's not a drug, then you don't really have to do a study in a like lab double-blinded setting. They've just done it on people, but like small numbers of people to show that there is benefit. But the benefits that they're actually only proclaiming to have. So when it's PDRN that's been injected into the skin, there are clinical benefits. PDRN has been around for very, very, very many years. And there are clinical papers to demonstrate that it's beneficial when it's injected into the skin.
I remember injecting it it, this is whenever I worked in Perth in Scotland, and we were injecting it into diabetic wounds in lower leg ulcers as part of the original trial. Now that honestly was in, I'm going to say 2001, so we had 25 years ago.
Yeah. It's been around for ages. In the topical skincare, which is far more accessible, obviously, to far more people, they have done some studies, but they're not proclaiming to be able to boost your collagen and elastin. Their claims are set at improved hydration, improved texture. So they're not saying that it's equivalent by any stretch of the imagination.
So it could well just be that there's some nice hyaluronic acid in the PDRN solution, and that is causing a bit more hydration on the skin. Could be.
God, you are skeptical today.
I'm so skeptical. I'm always skeptical. I trust no one when it comes to this. So the thought is that this is something that you think is a good idea, or you would buy, or
you can buy it. You can buy it off the shelf.
Would you buy it?
I've got it.
But would you tell somebody to buy it? Like,
No. Have I ever recommended it? No. Essentially, the reason why it's trending is because it's extrapolating some of the evidence from injectable PDRN. And now that they've found a way to incorporate it into a topical formulation, but they're not using the same claims. But for most people, they would think, oh, PDRN, lots of evidence in the injectable form. That's going to have the same benefit if I were to slap it on my skin.
Yeah.
So I think that's why it's trending.
Okay, so it's trending, but we don't necessarily love the idea of it.
Yeah, it's trending, but I'm not saying like everyone go out and buy some PDRN serum.
Yeah, got it.
Yeah. Just be aware. Listeners to know.
I think as well, if we go back to maybe other ingredients that we see in topical skincare, I've started to notice a little bit of a resurgence in lactic acid again.
Good old lactic acid.
I know. Lactic acid is one of these alpha hydroxy acids. So like an idea of, I suppose, a glycolic acid, except the molecule itself is much bigger. So it doesn't penetrate into the skin quite as quickly or as fast as like the tiny little molecules of glycolic acid. But essentially it's used to brighten the skin and exfoliate the skin. So we think of it as being a chemical exfoliator. And it's particularly useful, I always think, in conditions like keratosis pilaris. This is a condition where you get bumpy, almost like goosebumps, chicken-like skin on the backs of the arms. It can sometimes extend down to the hands. You get it on the thighs. And you tend to get this as a kind of older child, and it really sticks with you the rest of your life. And it's incredibly common. But these little bumps that occur around the hair follicles are essentially just almost like trapped bits of dead skin cells. And when you have something that's a trapped bit of dead skin cell, using an exfoliator can be really helpful to remove that dead skin cell. And some people would scrub this away, which is a mechanical exfoliator. But if you're able to use a chemical, that's a bit gentler on the skin and it chemically exfoliates them away. And of all the different chemical exfoliators there are, partly because of the size of the lactic acid molecule, but it can be really nice at gently exfoliating these away, and it's just not as harsh as some of them. So for people who have really sensitive skin and they want to still do a little bit of exfoliating, I think lactic acid is really kind of quite lovely for that.
It's lovely. And the brand that does lots of nice lactic acid products for KP, keratosis pilaris, is Ameliorate.
Yeah, I love Ameliorate.
Recommend it? Yeah, same.
I really do like that. That's the reason why you would see these TikTok trends of people putting yogurt on their faces to try and get the lactic acid that's in the yogurt to do that same kind of a job. But part of the problem with that is that with the lactic acid in a yogurt, it's never really at the concentration that you need it to be at.
Please let's not encourage people to put yogurt on their skin.
I mean, it's not a bad thing, is it? It's not like some of these things. It's not bad, but if you want to do it for a chemical exfoliant, it's much better to get a strength of about maybe 5% lactic acid. Whereas if you're putting a strained kind of yogurt on your face, then it's not going to be as strong. That's only about maybe a 1% or something like that. It's not typically strong enough.
Eat the yogurt, buy the lactic acid.
And then one of the other things I've seen as well that seems to be trending is, and this isn't new, this has been around for a long time again, but sometimes something weirdly makes it suddenly hit an algorithm where it starts trending, is this idea of multi-sized hyaluronic acid within a single formulation. And so what I mean by that is hyaluronic acid is obviously a wonderful humectant. That means it draws water onto the molecule. And as it draws water onto the molecule, it expands a little bit. So if you imagine it's on your skin, drawing a little bit of water into that molecule, expanding it. And it just means that wrinkle depth is not as deep. Your skin feels a bit kind of plumper and light reflects off it a bit better. It's just a temporary hydration of the skin. And so different sizes of hyaluronic acid can actually get to slightly different positions within the very top layer of the skin. Nothing's getting into the dermis, but within the very top layers of the skin. But one of the things that is probably worth noting is that by the time you get down to these very tiny little hyaluronic acid molecule particle sizes, they have been shown to be a bit pro-inflammatory in the skin. So you probably actually want larger molecular weight hyaluronic acid and then maybe around a medium weight hyaluronic acid, but getting down to the very small sizes, I don't think that's probably doing your skin any favors, but that seems to be a trending thing at the minute, these different molecules of hyaluronic acid sizes.
Yeah, I've seen quite a few of those.
I mean, there's hyaluronic acid in absolutely everything.
Everything, absolutely everything.
Yeah, because people just know that, manufacturers know it's going to give the skin an immediate benefit, so you might as well put it in. So if we think about the products that we're using and will continue to use in 2026, what are yours?
So, I mean, it's not going anywhere. My Clearer Nighttime Special is an absolute firm favourite. I get anxiety if the delivery is like not going, like we moved house and I was like, please be aware we have moved house. Do not send to the old address. Need immediately.
Yeah, I'm the same. I mean, my Clearer Night Special is going to stay with me for forever. I am not doing without it. I don't care whether there's a trend, whether there's not a trend, it is with me. Just because I know that's the thing that's making a real difference to how my skin functions and behaves. So that's my old school thing that's just going to stay now forever. But is there anything new that you've got or acquired or you think that might be something that you'll be adding in?
Yeah, my Medicate peptide cream. So I love the Medicate. It was called liquid peptides and that was lovely. And then they sent me their peptide cream and I use that as my night cream. Absolutely adore.
Over the top of your special or underneath?
Yeah. Over the top. Yeah. After I've used it. Or I always put the Clearer Special on my cleanse face because I think it's just got the most benefit that way. And only in the winter months really do I need to put moisturizer on over the top. But if I'm going to put a moisturizer on, I might as well do a peptide one because I love peptide moisturizer and that's the one that I'm really liking. So I think I'll carry that on whilst it's cold.
I suppose mine is a really boring one because it has been really cold and it's winter right now. So I'm kind of the immediate thing that comes into my mind that I have really been loving is the Aveeno ointment for very dry skin. Have you seen this one? It's for hands, feet and lips.
No.
It's really gorgeous. It's a very thick ointment, a bit like the CeraVe healing ointment or a Vaseline almost, but it has their Aveeno oat complex in it. So that's my kind of new go-to that I'll take into 2026, but only until it stops being so cold.
And then in the summer, we'll probably switch it up again.
Exactly.
So basically the trends are...
There's no trend.
There's no trend. That's the trend.
Yeah. But actually, that is the trend. Look for the real science. Look for the real benefit.
Yes.
Not thinking that just because one thing suits somebody, so that's definitely going to suit you. You're unique, you're individual, your skincare needs are different.
Yes.
And finding the thing that's right for you is kind of the priority.
The trend is to critically appraise the trends.
Yes. Love it.
That's our trend.
And that's a wrap. We hope you enjoyed this episode and hopefully it's given you a chance to understand which trends are here to stay and which ones you can just scroll on past.
Thanks so much for listening. Let us know what you thought of the episode, which trends you're loving and which trends you're not loving.
As always, keep sending in your questions. We actually really want to answer your questions and it'll be great to do an episode on it. All of the details you'll find in the show notes.
And don't forget to follow, subscribe and find us on socials.
Take care of yourself and your skin and don't forget to wear your SPF.
And we'll see you next time on the After Our Skin Clinic.